What are the alternatives to Baclofen? If you or someone you know is dealing with muscle stiffness or spasms, especially in the context of Parkinson's disease, you might be curious about alternatives to Baclofen. Baclofen is often prescribed to help manage these symptoms, but it isn't the only option available. Some individuals may not tolerate Baclofen well, or it may not be effective for everyone. So, what are the alternatives? First, let's talk about other muscle relaxants. Clonazepam, also known as Rivotril, is a benzodiazepine that can help relax muscles and reduce spasms. Tizanidine is another muscle relaxant that works differently from Baclofen and is sometimes used for muscle stiffness. Diazepam, commonly known as Valium, can provide short-term relief for muscle spasms, but it is not recommended for long-term use due to risks of dependence and sedation. Other muscle relaxants like methocarbamol, cyclobenzaprine, and carisoprodol are also options, though they are less commonly used in Parkinson's disease. Anticholinergic medications can also be beneficial. These drugs, such as trihexyphenidyl and procyclidine, help manage muscle stiffness and involuntary muscle contractions, known as dystonia. They work by blocking certain neurotransmitters in the brain. However, they may cause side effects like dry mouth and confusion, especially in older adults. For localized muscle stiffness or dystonia, botulinum toxin injections, commonly referred to as Botox, can be very effective. These injections temporarily weaken the affected muscles, providing relief for several months. This treatment typically requires repeat sessions and is administered by a specialist. In addition to these medications, adjusting or adding other Parkinson's medications, like dopamine agonists such as apomorphine, can sometimes improve muscle stiffness and dystonia. These drugs mimic the effects of dopamine in the brain, which can help reduce motor symptoms. It's also important to consider non-medication approaches. Physical therapy can be incredibly helpful. Regular stretching and strengthening exercises can improve flexibility and reduce stiffness. Some people find that sensory tricks, like gently touching or stretching the affected limb, can provide temporary relief from dystonia. Occupational therapy can also help by teaching techniques to adapt daily activities, making it easier to manage symptoms. Remember, not all treatments are suitable for everyone. The choice of an alternative to Baclofen depends on individual symptoms, overall health, and potential side effects. It is crucial to consult with a healthcare professional, such as a neurologist or Parkinson's nurse, to discuss the best options for your situation. In summary, there are several alternatives to Baclofen for managing muscle stiffness and dystonia in Parkinson's disease. These include other muscle relaxants, anticholinergics, botulinum toxin injections, and adjustments to Parkinson's medications. Non-drug strategies like physical therapy and sensory tricks can also be beneficial. Always seek personalized medical advice to find the best approach for you.